These are our current board members here at the African American Health Institute. Mr. Alton Garrett is actually the founding the chairman for the board. And we have Sharon and Decep and Dr. Nolan, and of course I have been the founding president and the chief officer of the African American Health Institute since its inception, which came about from a county-wide strategic planning project that I directed in San Bernardino back in 2003. From 2003 until 2005, we initiated the African American Health Initiative for San Bernardino County. And actually, here is one of our flyers that we have remaining from when we were advertising the initiative. And one of the startling facts here in San Bernardino was that black men, according to our statistics, were dying at age 56 and black women at an average age of 62 here in San Bernardino. So we sought to understand what was going on here in our county, that we had such early deaths, because 56 is very young for a black male. And the results of our study, again, indicated that there were complex reasons for that, whether it dealt with perpetual and ongoing stress, dealing with lifestyle issues such as high blood pressure and other chronic conditions, diabetes that's out of control, cancer, HIV and AIDS. We have a very high rate of HIV here in our county, and also infant mortality. So we were seeing across the lifespan, from very young to the older adults, and the in-between, the youth, we have a huge issue related to violence. According to some of our statistics, indicates that we have about 495 registered gangs, and within those particular gang membership, there are probably anywhere between 12,000 to 15,000 gang members. So we have a strong gang task force that's been working on these issues for several years, and trying to make a little dent in that and have our youth to be able to graduate from school and have productive and viable lives. This was created by black men in a 10-year-long research project.
10 years?
10 years. We started this at Loma Linda, and we actually talked with men and interviewed men about what items were critical for them and very important for them in making decisions about prostate cancer prevention. And so a part of it was to truly understand the anatomy and physiology of the prostate gland and where it is, what it does, and why the test. And this is a very important area. When you look at the prostate, which is just below the bladder, here's the rectum, and when you have those awful rectal examination that you men do not like, this is the reason why. You see how thin the wall is here, that the doctors can actually palpate and feel the prostate gland. So they're feeling for different changes in the gland, like in this one. That the reason it's lumpy and everything is that's what cancer would feel like and would look like. And sometimes the nodulars are deep in there and you can't feel that. So you have to examine it and actually palpate, and if you feel right there, you can feel it. But just to look at it, it's the same size as a normal one, but it actually has a very large cancerous growth in it. Yeah. So, and men could better understand what was going on inside of them and why they were being asked to take certain examinations and to and why they had the problems that they had. So when you talk about your prostate gland being enlarged, as you can see here, the place where the urine comes out, when it's enlarged, that's going to cut off your urine. That's the why. It's right at the base of your bladder. Wide project where we created this material for the Office of the Patient Advocate for the state of California to help black people get the right type of health care by pointing them to the direction as to where the resources are, and creating material that they could identify with. And so you can see it's colorful, has a kente cloth on it, has a variation of black people there, and so people can identify with this information really well. Same way with the mental health services. This is for general health care. This is for mental health. A lot of times black people are not aware of issues that they may be faced with that indicates that they need assistance from either a psychologist, a social worker, a marriage family therapist, or a psychiatrist. And like when you see the male in the picture, when the male is hurting, the entire family hurts. Where is he hurting? He's hurting in his head. You can see it in his eyes, and you can see that he's having distress. And we did focus groups with this material, and people described for us exactly what they felt the material needs to look like. So they indicated that when the man's head feels like it's exploding or it's coming apart, that he's having problems. He could hear ringing in his ears. These are indications, especially when you have these severe mood swings, or if you have things that are going on in your life and you can't quite put your finger on what the problem is. It may be that you need assistance with mental issues. So we wanted to indicate that there's a lot of trauma that goes on in our lives. We're dealing with intergenerational traumas that stem from just living black in America. And so it's okay, you're not alone, and that's the message that we want to get across, is that you may need to see a doctor. There are times when you may need to see someone, a doctor for an example, after you've had a physical examination, and that there may not be anything physical that you can point to that you're having problems with. It may be emotional or maybe psychological. So there are people that can help you. And also in situations where you want to call somebody, you've got the National Alliance on Mental Illness, NAMI, and the number is 916-567-0163, and this is, they can provide assistance for you. And then other times, I like this one also, Suicide Prevention Hotline, and you just need to talk to somebody. You may need to talk to them immediately. 1-800-273-8255, and it's okay to call confidentially, and you can be able to talk to someone about what's going on. And it's a neutral party, because sometimes we feel like other people may not understand what's going on with us, and it may be that they do not understand. And of course, when you have caring family members or close friends or associates, those are excellent individuals to talk to, and these are people that you can trust that you would turn to. But if you do not, then of course calling for assistance, and this is a good reference for us to use.